Okay, we're going to extend some of what Marianne was talking about, the work out at the Gawa there with the Wi-Fi. We're going to hear from Kathy Gotha Guthadjaka. I hope I didn't murder that too badly. With the last name of Fitzner, I'm used to having mine murdered fairly often. So apologies, Kathy, if I wrecked that. And Mr. Colin Baker. Kathy is a senior elder from Gawa and has worked at for over 50 years and has always had a strong interest in research. She's currently employed as part-time senior research fellow at the Northern Institute. And Kathy is interested in collaborative qualitative research projects where she can share her Aboriginal knowledge and expertise. She's keen to oversee, to cover multidisciplinary areas in her partnership projects. Is it just a little bit of a correction here? Is it Colin Baker or Colin Russell?
Colin Russell.
Colin Russell, okay, I've got two different names here. Colin, in partnership with Kathy, Colin established the Gawa Christian School. Colin has a number of joint publications with Kathy and other members of staff from the Northern Institute, and Colin works tirelessly to secure better services and infrastructure for the Gawa community. Over to Kathy.
Gotha and Colin.
Gotha and Colin. Thank you.
Yeah, hello. Thank you for giving us a little bit of time. Are we fine with Mike? Are you hearing us there?
Oh, good.
Great. Okay, first of all, we'd just like to say that we are very keen to see a couple of young people at Gawa trained up as telehealth technicians. And we're starting on this pathway, and we're very keen to break through all the hurdles that are there at the moment. And we look forward to the day when that service will be functioning well out there. Even just having the Wi-Fi out there has made a tremendous difference in the area of health at Gawa. My wife, Gotha, Kathy, is here in Darwin. We're stuck here really on renal dialysis. We're here for health reasons. We can't really get away. Now making use of the new renal unit at Galliwinkle for extended breaks out there. But it was such a wonderful relief to be able to talk to people back home, to talk to family and keep up to date with what's going on. One of the first, of course, urgent calls that we got was in relation to COVID-19 vaccination. The people out there, you could imagine if you were living remote and without communication with the outside world, and you hear all these stories, you're going to have a lot of questions before you decide to go ahead and let someone jab you in the arm with something you don't know anything about. So communication has been a really big help in that situation. First call we got was from the old man of the community who wanted to know the story. People go out there from government to try to encourage people for vaccination, which is a good thing, but unable to answer the key questions that they have. Government policy actually forbids their workers from really handling those questions in a proper way. And so we were able to tell the people at Gawa, for one thing, hey, you know, the mob at Marpuru have all been vaccinated with AstraZeneca, no problems whatsoever, the whole community. And that little piece of information that came through the Wi-Fi network, which, you know, wasn't there 6 months ago, really set people at ease and answered a lot of their questions. we've been able to talk to people and encourage them to go ahead and get prepared for the crisis that's approaching. It's a health crisis, and the people out there are relieved to be able to get on the telephone and talk with trusted sources outside of the community. And what a difference this has made. This has been amazing. Thank you very much.
Hello?
That's really about all we've got to say about that. About the Wi-Fi system.
Thank you, guys. Much appreciated.
Thank you, Colin. Thank you, Gotha.
Forward to the day when we can talk a lot more about telehealth and about how our technicians are going.